Consider the following statement: systemic inflammatory response syndrome is characterized by, so it is characterized by temperature either above 38 degrees Celsius or below 36 degrees Celsius, and tachypnea more than 20 per minute, and leukocyte count more than 4 into 10 raised to 9 per liter. What it does not include is heart rate less than 80 per minute. So what is true about septic shock? Vascular dilation, hypotension is a late sign, and widespread endothelial dysfunction. Which fluid is used in hypovolemic shock? RL, NS and blood. Systemic inflammatory response syndrome SIRS is characterized by the following except, so it is not characterized by white cell count less than 5000 per millimeter cube or tachypnea with a respiratory rate of more than 20 per minute, and it is characterized by release of lipopolysaccharide endotoxin from the wall of dying gram negative bacilli and tachycardia with the heart rate of more than 90 per minute. And now rheumatic fever. What is true about rheumatic heart disease and rheumatic fever? It is caused by group A streptococci. Carrier have low risk of developing rheumatoid factor and M5 protein cross reacts. All are true about rheumatic fever except communicable disease. It is not a communicable disease. It is common in poor socio-economic group, develops after streptococcal pharyngitis, and it is seen in 5 to 15 year of children. Now, what is true about acute rheumatic fever, chorea, arthritis and carditis? These three things are true about acute rheumatic fever. Now, what is the major criteria of rheumatic fever? Chorea, arthritis and carditis. These are the major criteria. True about rheumatic fever, chorea is aggravated during pregnancy. True statement about rheumatic fever in children, polyarthritis and most common valve involvement is mitral. A patient presents with acute rheumatic carditis with fever. What is true statement? Valve replacement will ameliorate the CCF. Earliest valvular lesion in a case of acute rheumatic fever is mitral regurgitation. Which valve is least affected in rheumatic fever? Pulmonary valve. What is true statement about rheumatization of mitral valve? Fusion and shortening of chordae tendineae in mitral stenosis, calcification of mitral valve and annular involvement. True about subcutaneous nodule in rheumatic fever, it is non-tender and present in extensor surfaces. Rheumatic activity involves mostly the mitral and aortic valve. In rheumatic heart disease, infective endocarditis is detected by echocardiogram, and the largest vegetation seen are due to Candida albicans. In rheumatic fever, which is seen? Sydenham chorea is seen. Vegetation on undersurface of atrioventricular valve are found in Libman-Sack endocarditis. ASO, that is anti-streptolysin O test, is used for the diagnosis of rheumatic fever. Which one of the following is not included in Jones' major criteria? High ESR is not included. Pancarditis, chorea and subcutaneous nodule is included. A 25-year-old person with history of repeated episode of rheumatic fever is hypersensitive to penicillin. Which of the following drug can be prescribed to him? Sulfasalazole. Infective endocarditis. Bacterial endocarditis is most commonly caused by Staphylococcus aureus. Now, which of the following is least likely to cause the infective endocarditis? Salmonella typhi. So, Streptococcus faecalis and Staphylococcus albus and Pseudomonas aeruginosa, these cause the infective endocarditis. A patient has prosthetic valve replacement and he develops endocarditis 8 months later. Organism responsible is Staphylococcus epidermidis. Infective endocarditis due to Pseudomonas is most commonly seen in intravenous drug abuse of pentazocine. The risk of developing infective endocarditis is the least in a patient with large atrial septal defect. Which one of the following cardiac lesion is at highest risk of occurrence of infective endocarditis? Valvular aortic regurgitation. Osler node are typically seen in which one of the following? Acute staphylococcal endocarditis. Osler node are seen at tip of palm and sole. Not a feature of infective endocarditis is thrombus in left atria. So the features of infective endocarditis are myocardial abscess, vegetation along cusp, and perforation of cusp. Infective endocarditis is least common in atrial septal defect. Endocarditis is most commonly seen in aortic stenosis. Bacterial endocarditis is rarely seen in ostium secundum atrial septal defect. Infective endocarditis is commonly seen in all except atrial septal defect. So it is seen in small VSD, tetralogy of Fallot, and patent ductus arteriosus. Least common site for vegetation is atrial septal defect. Which of the heart valve is most likely to be involved by infective endocarditis following a septic abortion? Tricuspid valve. Most common heart valve involved in IV drug user is tricuspid valve. Least common cause of endocarditis is atrial septal defect. Infective endocarditis is most commonly seen in ventricular septal defect. In a patient of heart disease, antibiotic prophylaxis for dental extraction is amoxicillin. Site of lesion in endocarditis of rheumatic heart disease is along line of closure of valve. Vegetation on undersurface of atrioventricular valve are found in Lebman-Sack endocarditis. In a patient of rheumatic heart disease with fever and mitral valve vegetation due to infective endocarditis, the vegetation usually do not embolize to lungs. They may embolize to brain, liver, or spleen. Mitral valve vegetation do not usually embolize to lung. An IV drug abuser presents with fever for 10 days. Chest X-ray shows bilateral lower lobe consolidation with necrosis and right-sided pyoneumothorax. Probable diagnosis is TB endocarditis due to Staphylococcus and or aureus. Now, a patient has prosthetic valve replacement and he develops endocarditis 8 months later. The organism responsible is Staphylococcus epidermidis. Which of the following statement is not true in the case of infective endocarditis caused by Hackett organism? The clinical course of Hackett endocarditis tends to be acute and fulminant is not true. What is true is culture of blood from patient with suspect Hackett endocarditis may require up to 30 days to be positive, and embolization is common and occurs in around 50% cases of Hackett endocarditis. Valvular vegetation are seen in up to 85% of patient. Which of the following is least likely to be associated with infective endocarditis? Small atrial septal defect. Endocarditis culture sampling is done as 3 cultures separated by 1 hour over 24 hours. A female of 40 years presenting with intolerance to cold, constipation, and hoarseness of voice was found to have cardiomegaly on chest roentgenogram. Which of the following investigation is the best to determine the cause of her cardiomegaly? Echocardiography. Now, tumor. Gradient in pulmonary artery wedge pressure and left ventricular end diastolic pressure is seen in left atrial myxoma. True statement about cardiac myxoma is it is commonest site as left atrium and it is more common in females. All of the following are clinical features of myxoma except hypertension. The features are fever, clubbing, and embolic phenomenon, but not hypertension. All of the following are usual feature of left atrial myxoma except markedly enlarged left atrium. So the features of left atrial myxoma are raised ESR, pyrexia, and systemic embolism. Commonest benign tumor of heart is myxoma. Atrial myxoma is associated with the following except systolic murmur at apex. So atrial myxoma is associated with fever, weight loss, and subungual splinter hemorrhage. MI and angina. Which one of the following is of the highest predictive value in the morbidity of coronary heart disease? Apolipoprotein B. Prinzmetal angina has the following characteristic except normal ECG without pain and ST depression with pain. So Prinzmetal angina has pain at rest, ST elevation during the attack, and represents the transmural ischemia. Temporal profile of detection of the given serum enzyme in acute MI is CPK, SGOT, LDH. A 50-year-old male has had precardial pain for 4 hours. On examination, his blood pressure is 110 by 80 mm of mercury. The pulse is 120 beat per minute and respiratory rate is 26 per minute. His ECG shows marked ST segment elevation in lead V3 to V6 and left ventricular ectopic. The initial therapeutic modality in this case would include streptokinase and morphine. Which one of the following is the drug of choice in a patient with acute myocardial infarction having premature ventricular contraction? None of these. Fibrous scar and myocardial infection in well established by 6 weeks. The complication of myocardial infarction are all except dissection of aorta. So the complication of MIR, pulmonary embolism, systemic embolism and ventricular fibrillation. All of the following predispose to IHD except alcoholism. So the predisposing factors to ischemic heart disease are smoking, obesity, sedentary habit and diabetes. Drug of choice to relieve pain in myocardial infarction is morphine. In acute myocardial infarction, the best drug to cause thrombolysis and to start reperfusion is tissue plasminogen activator. TMT is done for evaluation of ischemic heart disease and for testing maximum working capacity, that is treadmill test. Duration of pain in angina is 2 to 5 minutes. Drug useful in acute myocardial infarction are all except nifedipine. The one organism which is responsible for coronary artery disease is chlamydia. A 40-year-old male is admitted with acute inferior wall myocardial infarction. Half an hour later, blood pressure is 80 by 50 mm of mercury and heart rate is 40 per minute. With sinus rhythm, the most appropriate step in the management of this patient would be intravenous administration of atropine sulfate. Critical narrowing of coronary blood vessel is 70%. Hypertriglyceridemia is not caused by cigarette smoking, it is caused by diabetes mellitus, obesity and alcohol. The level of LDL cholesterol at which therapy should be initiated in a patient without coronary artery disease and no risk factor is 190 mg per deciliter. Patient is having normal CK and CKMB after 2 days of chest pain. Which of the following is true? It excludes the diagnosis of myocardial infarction. Which one of the following is an absolute contraindication to the use of thrombolytic agent in the setting of an acute anterior wall myocardial infarction? History of CVA with hemiparesis 1 month ago, that is cerebrovascular stroke, cerebrovascular attack. What is the diagnostic of fresh myocardial infarction in ECG? ST segment elevation. Long-term secondary prevention following myocardial infarction is recommended with which one of the following drug? Antiplatelet drugs. Myocardial isoenzyme of cytokine CK, which is specific for myocardial infarction, is CKMB. All the following are indication for treadmill testing except to evaluate the unstable angina. So what are the indication for treadmill testing? To evaluate the unstable myocardial infarction, to assess the outcome after coronary revascularization and to diagnose and evaluate the treatment of exercise induced arrhythmias. The best possible intervention for acute myocardial infarction is early primary coronary intervention. LDH by LDH2 in acute myocardial infarction is more than 1.0. Acute coronary syndrome includes all except stable angina. So it includes STEMI, NSTEMI and unstable angina. Which of the following is common risk factor for coronary heart disease except? And with reference to right ventricular myocardial infarction, consider the following statement and which are correct. So all these sentences are correct. Right ventricular myocardial infarction, it may occur along with inferior wall myocardial infarction. The ECG shows ST segment elevation in right precordial lead. Prognosis in right ventricular infarction is better than the left ventricular myocardial infarction. The treatment may include intravenous fluid challenge, ST depression and T wave inversion in V1 to V6 and AVL lead indicate the anterolateral wall acute myocardial infarction. Which of the following component is not considered in the definition of metabolic syndrome? High LDL. A 30-year-old male presents with severe pain, chest, breathlessness, hypertension and ECG shows ST elevation in V3, V4, V5 and V6 lead. He will be best treated with PTCA. All of the following dietary goals are recommended for patient with high risk of coronary heart disease except avoid alcohol. So Which are the dietary goals recommended for patient with a high risk coronary heart disease? LDL cholesterol less than 100 mg per dl, and saturated fat less than 7% of total calories. Salt restriction less than 6 gram per day. ECG is poor in detecting ischemia in areas supplied by which of the following vessels? Left circumflex. A 45-year-old man is hospitalized with acute inferior wall myocardial infarction. He develops sinus bradycardia at 40 beats per minute and his blood pressure is 100 by 60 mm of mercury. Which of the following should be the first line intervention? IV atropine. A 56-year-old diabetic male patient who underwent a CABG for triple vessel disease is brought to the emergency with sudden onset inability to speak since the last 2 hours. He can understand what is being said to him but cannot speak. His blood pressure is 200 by 110 mm of mercury. The emergency CT scan of the head is normal. The next step in the management would be control the blood pressure. Next is drugs. A 40-year-old male presents with headache and convulsion. His blood pressure is 210 by 140. Fundus examination reveals papilloedema. Which one of the following drug combination will suitable? Nitroprusside and furosemide. Angiotensin converting enzyme inhibitor are not used in CHF resulting from aortic stenosis. Antihypertensive causing impotency, propranolol, atenolol and nifedipine. Non-ischemic chest pain is caused by bleomycin. Gynecomastia is caused by phenytoin. Now some miscellaneous difference between upper and lower limb blood pressure is usually 5 mm, and syphilis causes all except, so syphilis causes linear calcification of aorta, aortic aneurysm, aortic regurgitation and coronary ostial stenosis.